Important infections caused by Pseudomonas aeruginosa. This section is actually a climax of this illustration video, as it is the most useful part of this illustration video. Anyway, Pseudomonas aeruginosa causes infections primarily in a patients with lowered immunity level. It can cause infections. It can cause infection virtually anywhere in the body, but the most important infections are pneumonia, wound infections, burn wound infections, sepsis, UTI, eye and ear infections, bone infections. Let's discuss each of them one by one. Pneumonia. The leading cause of ventilator associated pneumonia is Pseudomonas aeruginosa. Patients in a critical care unit are immunocompromised. That it means that they may be neutropenic patients, they may have hypogammaglobulinemia, patient with cystic fibrosis, and these patients have predisposing factors, and these patients are good candidates for pneumonia caused by Pseudomonas aeruginosa. Pseudomonas can also cause community-acquired pneumonia in patients with pre-existing risk factors, like the patients with HIV, like the patients who are neutropenic, uh, the patients who have solid organ or bone marrow transplants. So these people have predisposing factors, and Pseudomonas can cause community-acquired pneumonia in these peoples. One more piece of information about pneumonia caused by Pseudomonas. In cystic fibrosis patient, Pseudomonas causes chronic pneumonia. Pseudomonas causes chronic pneumonia. This chronic pneumonia progressively destroys the lung. And keep in mind, chronic pneumonia in a patient with cystic fibrosis is a leading cause of death. Okay, after pneumonia, we have a section for the burn wound infections. Patients Patients with a burn are immunocompromised because the defensive role of skin has been disrupted. The normal flora of skin is replaced by a hospital flora in which the Pseudomonas is the most important pathogen. You can observe in this burn patient the bluish green discoloration or coloration. It indicates infection caused by Pseudomonas. The fruity aroma or the grape-like smell can be smelt in this wound, and this is a presumptive indication of Pseudomonas aeruginosa infection. Okay, the treatment would involve debridement and anti-pseudomonal microbial agents. Okay, the third one infection that we will discuss is sepsis. Sepsis caused by Pseudomonas aeruginosa is really dangerous because the mortality rate is so high with the sepsis caused by Pseudomonas aeruginosa. The mortality rate is more than 50%. The mortality rate is more than 50%. You know, Pseudomonas aeruginosa is gram negative rod, and its wall has endotoxin, and this endotoxin would cause the sepsis and septic shock. Okay, when the Pseudomonas gets into the bloodstream, from a wound, from a lung, from a bone infection, it would lead to the sepsis and will cause septic shock. Pseudomonas also have exotoxin, and most important is exotoxin A, that acts like the diphtheria toxin, and it would lead to the ADP ribosylation of EF2 factor, and it would lead to ultimately the inhibition of the protein synthesis, and the inhibition of the protein synthesis would lead to the tissue necrosis. And this and one cutaneous manifestation of this tissue necrosis is ecthyma gangrenosum. Ecthyma gangrenosum. You can see this black necrotic lesion. This is called ecthyma gangrenosum. It occurs when it occurs in sepsis when the bacteria spreads from blood to the skin, and you can see in this lesion that there is a the lesion has black necrotic center, and the margins are erythematous. Okay, this lesion, which is called the ecthyma gangrenosum, often does not have pus, and the specimen from this lesion and gram staining of the specimen from this lesion and the culture would yield to the Pseudomonas aeruginosa. You can see the sepsis with ecthyma gangrenosum in this ill patient. Another important infection caused by Pseudomonas is necrotizing fasciitis. Pseudomonas causes the necrotizing fasciitis in diabetic and neutropenic patients. Okay, next one is UTI and the pyelonephritis. Pseudomonas can cause UTI and pyelonephritis in debilitated patients, the patients who are residing in nursing home, who are hospitalized patients, and these patients often have urethral Foley catheter and have some sort of urinary system instrumentation, which acts or behave like a source of infection. And this is an important thing, because it is the third most common cause of UTI, nosocomial UTI. Okay, these patients have some sort of pre-existing risk factors like the chronic prostatitis, nephrolithiasis, and prior antibiotic therapy. Regarding management, it is important that the predisposing factors should be managed first, and the sources of infection should be managed, and the antimicrobial therapy should be initiated. Okay, the next one is osteomyelitis. Pseudomonas aeruginosa is one of the most common causes of infections in environmentally contaminated wounds, and it is the most common cause of infection in these type of wounds. One example is osteomyelitis after nail puncture wound of the foot, osteomyelitis after compound fracture, osteomyelitis after nail puncture wounds. Diabetic patients have increased risk of developing osteomyelitis because they have foot ulcers, and these foot ulcers could be infected with Pseudomonas aeruginosa, and the infection from the ulcers penetrates into the bone, and when it spreads from the wound into the bone, it causes the osteomyelitis. Similarly, in IV drug abusers, what happens? They develop osteomyelitis of vertebra or clavicle. How to manage the osteomyelitis caused by Pseudomonas aeruginosa? We shall discuss the management of Pseudomonas aeruginosa infection at the end of illustration video. Let's discuss an important subset of osteomyelitis caused by Pseudomonas aeruginosa. That's malignant external otitis. It develops in patients with diabetes, patients with HIV. These patients are at increased risk of developing malignant external otitis. There are several factors that makes diabetics a potential candidate for malignant external otitis. The patients with diabetes have microangiopathy in ear canal, and these factors lower the immunity level, and this lowered immunity level gives opportunity to Pseudomonas aeruginosa to cause infection in external ear canal and cause more and more infection that would lead to the malignant external otitis. Malignant external otitis. When Pseudomonas causes mild infection, it is called swimmer's ear. In swimmer's ear, immunity level is adequate. So, Pseudomonas aeruginosa infection only causes mild external otitis. But in individuals with compromised immunity level, it can cause the infection of external ear canal that burrows into mastoid and then progress to the temporal bone. You can see another view of malignant or necrotizing external otitis in this diabetic female. Please appreciate please appreciate the word elderly and diabetic patient. These are actually pre-existing risk factors that make someone prone to develop malignant external otitis. Okay, and two specific diseases are highly associated with diabetes. This is the fact that I want you to appreciate. Two specific diseases are highly associated with diabetes. One is malignant external otitis and the other one is mucormycosis, that is called by molds. Okay, let's conclude the malignant external otitis with some very important facts about it. In malignant external otitis, the clinical signs of infections are notably absent. Means that there is no remarkable fever, or there is not a remarkable leukocytosis or systemic toxicity. The most common presenting symptom is otalgia, that is followed by severe excruciating headache. And you would need a CT scan or MRI to diagnose the malignant external otitis, in which you would find bone erosion or soft tissue abnormalities of the temporal or the mastoid bone. Okay, we shall discuss the treatment options of Pseudomonas aeruginosa infection at the end of illustration video. Green nail syndrome and paronychia. Green nail syndrome is infection of the nail bed that is caused by Pseudomonas aeruginosa. In it, nail bed shows bluish green discoloration. This bluish green discoloration is due to the pyocyanin and pyoverdin that is adhering to the undersurface of the nail plate. This discoloration may persist even after treatment. Patients who develop this syndrome, green nail syndrome, have some risk factors like the chronic paronychia, prolonged immersion, exposure to fresh water or the hot water. So the patients with green nail syndrome are advised to avoid excessive hot water immersion, and they should wear protective gloves. They should dry nails after washing hands, and they should of course trim nails. Paronychia. Paronychia is the most common hand infection. The most common hand infection, and it is caused by number one, Staph aureus, and number two, Pseudomonas aeruginosa. So the Pseudomonas aeruginosa is actually not the number one cause of paronychia, but a significant or the important cause of paronychia. Paronychia, paronychial infection develops when the seal between the nail fold and the nail plate is disrupted. When there is a disruption, the Pseudomonas aeruginosa finds a portal of entry. When it finds the portal of entry, it goes there and causes the infection. That's the way. The management is incision and drainage and antimicrobial therapy. Okay, The next one is hot tub folliculitis. Hot tub folliculitis. It is infection of the hair follicles that occur as a result of bathing in a tub or in an object that is contaminated with Pseudomonas aeruginosa. See this picture of 42-year-old female. She has multiple papules and pustules on her back. While taking history, she told that she was in hot tub twice over previous weekend. Anyway, hot tub folliculitis is self-limited infection and needs nothing. Only just avoiding the objects contaminated with Pseudomonas aeruginosa, like the hot tubs, like the swimming pools in which there is not an there is not which are not adequately chlorinated. So these avoiding these objects is sufficient to treat hot tub folliculitis. Let's conclude this section with ocular infection caused by Pseudomonas aeruginosa. Pseudomonas aeruginosa causes corneal infections in contact lens wearers. The people who wears contact lens, Pseudomonas aeruginosa causes corneal infection. The risk factors include trauma, recent surgery, contaminated lens solution. These factors leads to the development of corneal ulceration, keratitis, and ophthalmitis. Okay, finally the last one entity to describe in this section is endocarditis. Although it is really caused by Pseudomonas, but in IV drug abusers it is a frequent cause of endocarditis. Okay, this is all about the important infections caused by Pseudomonas aeruginosa.